how Africa is finally taking ownership of its future. In Abuja, during the Nigerian Economic Society's 66th annual conference, African leaders, economists, and development experts gathered with a common message: Africa's transition states cannot afford business as usual. They are calling for sweeping governance reforms, stronger domestic resource mobilization, and innovative partnerships to drive real economic transformation. The policy dialogue was hosted by the African Development Institute of the African Development Bank Group. The theme, Driving Africa's Economic Transformation in Transition States, the role of capacity development and knowledge management. Transition states are Africa's most vulnerable economies facing political, economic, and environmental instability. Abdul Kamara, the bank's Director General for Nigeria, opened with sobering numbers. For Africa to achieve the African Union's Agenda 2063 goals, growth must hit at least 7% annually for decades. Yet the continent faces a staggering funding gap: $680 billion every year. Transition states alone need $210 billion annually but fall short by nearly $188 billion. Kamara stressed that inclusive growth, job creation, and youth empowerment are not optional, they are central to Africa's survival. He highlighted programs like Nigeria's $618 million IDIS initiative, designed to boost innovation, technology, and the creative economy. Shout out to our dear subscribers. To our non-subscribing friends, your support is just as valuable. If you can take a second to hit the subscribe button, that will be fantastic. Eric Ogunleye, director of the African Development Institute, warned of a growing crisis. 24 countries are now classified as transition states, up from 22 just 4 years ago. Over 250 million Africans are affected by fragility, and more than 44 million have been displaced. Conflict, he said, has slashed economic growth in affected countries by up to 20%, draining resources away from health, education, and infrastructure. Experts at the dialogue agreed conflict resolution and governance reform must come first. Emmanuel Owusu-Sekier of the African Center for Economic Transformation emphasized that without peace and accountable leadership, development cannot begin. He also pointed to corruption and weak political will as Africa's elephant in the room. Financing challenges remain steep. Africa's tax-to-GDP ratio stands at just 17%, far below other regions. Illicit financial flows are draining $90 billion every year, while remittances, though growing, cannot fill the gap. Jane Mariara, executive director of the Partnership for Economic Policy, underscored the potential of climate finance, which brought $137 billion to Africa in 2024. She urged governments to build stronger debt management systems and engage the private sector through blended finance. From Abuja, the message was clear: transformation will only come through governance reform, sustainable financing, and partnerships that prioritize Africa's most fragile economies. Seedwell Hove, from the African Development Institute, summed it up: without strong capacity development and knowledge management, Africa's journey from fragility to resilience will remain out of reach. But governance is just one part of Africa's transformation story. True resilience also depends on something more basic: whether Africans can stay healthy and thrive. And here too, the warning signs are urgent. The global health system is changing, and not in Africa's favor. International funding for health is shrinking, weakened by protectionist policies and governments turning inward. For Africa, this isn't just a funding crisis, it's a wake-up call. Experts say the continent must take charge of its own health future. This is the new era of health sovereignty. Despite accounting for just 30% of global births, sub-Saharan Africa faces over 70% of maternal deaths and more than half of global under-5 deaths. Neonatal mortality here is the highest in the world. The statistics are stark, but they are also a call to action. Africa imports almost all of its medicines and vaccines, leaving its people vulnerable to global supply shocks. To change this, the African Union has set an ambitious target: produce 60% of vaccines locally by 2040. Achieving this goal means investing in everything from research and development to manufacturing to regulatory systems that can guarantee quality. Initiatives are already in motion. The Africa Vaccine Manufacturing Accelerator offers financial incentives to local producers. The African Medicines Agency is harmonizing regulations. And through pooled procurement, the continent is beginning to buy essential health commodities on its own terms. But the challenges remain urgent. Postpartum hemorrhage is still the leading cause of maternal deaths. Medicines like tranexamic acid and magnesium sulfate are effective and affordable, but Africa continues to import most of them even though local manufacturers already have the capacity to produce them. And it's not just about supplies. Without doctors, nurses, and midwives, even the best medicines don't save lives. Africa carries 24% of the world's disease burden, but has only 3% of the health workforce. The problem is worse in rural areas where the majority of Africans live. In Uganda, 70% of doctors serve just 12% of the urban population. In Zambia, there's only one doctor for every 12,000 people. And the brain drain continues. Nigeria alone lost over 9,000 doctors to Europe and North America in just 2 years. The African Union's Migration Policy Framework and Africa Health Strategy both call for solutions, better training, fair pay, and stronger retention strategies to keep health workers where they're needed most. Experts say the way forward is clear: invest in community-led primary health care, build resilient supply chains, and finance local pharmaceutical production. Partnerships with the private sector can unlock new resources, while regional collaboration ensures African-produced medicines meet global standards. Africa's health sovereignty is not just about self-reliance, it's about equity. It's about ensuring that women, children, and adolescents have access to the medicines, doctors, and services they need when and where they need them. In a world where global solidarity is fading, Africa's path forward is clear: invest in its own people, its own systems, and its own future. Health sovereignty is not just an ambition, it's a necessity. And just as health sovereignty defines the future of Africa's people, environmental sovereignty defines the future of its land. From hospitals to forests, the same lesson applies: Africa must lead its own solutions. At the Second Africa Climate Summit in Addis Ababa, leaders from across Africa joined forces with farmer cooperatives, innovators, and international partners to tackle one of the biggest global challenges of our time: deforestation. The focus was clear: how to meet Europe's new deforestation-free regulation while protecting Africa's forests, securing rural livelihoods, and building sustainable value chains for the future. The side event, Building Deforestation-Free Value Chains: Lessons from Africa's Coffee and Cocoa Sectors, showcased Africa's leadership, particularly with powerful examples from Uganda and Côte d'Ivoire. It also marked milestones in EU-Africa cooperation, celebrating 50 years of EU-Ethiopia relations and 25 years of the OU partnership. The urgency is real. In 2024, the world lost 6.7 million hectares of primary tropical forest, a 19% rise from the year before. In Africa, more than 90% of deforestation between 2021 and 2024 was driven by agriculture. Consumers both in Europe and in Africa are demanding change. People no longer want food that comes at the cost of forests. The UDER goals are: stop deforestation-linked products from entering EU markets, cut 32 million tons of carbon emissions annually, build transparent, sustainable agricultural supply chains. And Africa isn't waiting. From geo-mapping millions of farmers to professionalizing cooperatives, the continent is designing its own solutions to make value chains both sustainable and profitable. Uganda has already geo-mapped 1.5 million farmers across 126 districts. Its national traceability system safeguards over $1 billion in coffee exports and creates new jobs, especially for young people. Officials stress that compliance is not just about technology, it's about trust, transparency, and empowering smallholder farmers. In the country of Côte d'Ivoire, where cocoa is king, the story is just as inspiring. With support from the EU and Enable, cooperatives are strengthening governance and sustainability. More than 50,000 farmers are now using tools like self-assessment checklists and payments for ecosystem services, which directly reward them for protecting trees and biodiversity. This is more than compliance. It's about diversifying incomes, tackling root causes of deforestation, and building a global reputation for sustainable cocoa. Speakers at the summit reminded the world, Africa is not a passive rule-taker. It is a frontrunner shaping global sustainable trade and setting the pace for building resilient, deforestation-free value chains. But time is short. The first compliance deadlines arrive in December 2025 for large operators and June 2026 for small and medium enterprises. The message from Addis Ababa is clear. Africa is turning global rules into opportunities, protecting its forests, empowering its farmers, and redefining sustainable trade. The next year will be decisive. For Vlog ND, I'm Sal Peer. Thank you for watching. Don't forget to subscribe to the channel. Like and share our videos. We appreciate your support so much.